So let me please introduce our next and final speaker of today's seminar is Dr. Jiang Du. Is a psychiatrist of Shanghai Mental Health Center in Jiatong University School of Medicine in Shanghai. She has worked in drugs field for almost 20 years with a research focus on drug use prevention and intervention. She has also conducted research on drug use and HIV, HCV-related risk behaviors among intravenous drug users. She was a PI of study on the influence of drug-related Q exposure on heroin dependence relapsing, funded by Shanghai Mental Health Center. And in 2007, she won a NIDA Invest Fellowship Award and went to UCLA on a project reducing HCV-HIV risk behaviors among injection drug users in China, and MRI study on hippocampus structural and white matter alteration of methamphetamine users. Jiang Du also provides training and education program to social workers and staff of primary care hospital. She will talk today about the development of ATS Metamphetamine use in China and treatment of dependence. Please, Jiang Du, the floor is yours.
Thank you. So I'm the last one, but the last is not least. Okay, today I will give a brief introduction of drug use in China and the intervention strategy we delivered to deal with this issue. I'm not sure how many people have been in China. So before the lecture, I will show you a slide what China is. China is a country with 5,000 years of civilization and covers an area of 9.6 million square kilometers and creating glorious science and culture. I think everybody knows the Great Wall is one of the construction wonders of the world, and other 4 great inventions of China like printing, paper making, and gunpowder and printing techniques. Others include Peking Opera and Monkey King and Kongzi, and others including the nice food. It's always, I think maybe next time the seminar will be held in China, and I will show you around them. And Shanghai, the city I stayed, is the largest city of China and located in the east of China with 24 million population. And Shanghai is also the financial center of China. Okay, this is our treatment center, established in 1997 and supported by local government and Shanghai Shanghai Mental Health Center. This is the only one public voluntary treatment institute for drug abuse in Shanghai. And we include inpatient and outpatient service and provide psychological and medical treatment to drug users. Okay, this slide shows you the drug abuse in China. In recent years, the number of drug use decreased according to the report of the government, but the number was still huge. Last year, there were about 2.4 million registered drug users in China, and the major drugs are meth, heroin, and ketamine. The abuse of synthetic drugs such as methamphetamine continues to increase, with more than 80% of newly discovered drug users are synthetic drug users, while traditional drugs such as heroin abuse showed a decreasing trend. And people under 35 age is the high-risk population for meth use. Compared to the traditional drug like heroin, we know the meth are more likely to induce psychotic symptoms and cognitive dysfunction. Moreover, there was no drug to treat meth dependence. This slide shows you the policy of drug prevention and intervention. The drug abuse appeared in China from 1980s. To deal with issue, the government established a compulsory treatment center all over the country. But in 2008, the government enacted drug control law. The situation changed a lot. Before the drug control law, the drug users regarded as offenders, and the government provided compulsory treatment only. But after the 2008, the drug user defined as offenders and also regarded as patients. So the government provided medical and psychological intervention to them. And the community recovery increased quickly after the drug control law. Okay, I will give an introduction of the community recovery system in China. Before the patient released from compulsory treatment center, the patient's social worker and policeman will make a contract. And based on the requirement of the contract, patients should do regular urine test and psychological assessment in the following 3 years. Social worker will provide social support to the drug user, including counseling, employment, and skill training. If the urine test is positive or the patient refuses to do urine test, they will be sent to the compulsory treatment again. Now, addiction has been defined as chronic relapse brain disease and involved multiple brain circles. So the treatment should address this target. Based on the current research, our group did a lot of this study to deal with the drug abuse problem. Oh, sorry. This picture shows you our group. We have 2 parts. One part is clinical work. We provide the treatment for the patient. Another group is for research. Most of the research group are PhD students. The first study we developed a longitudinal study of ATS and heroin with the aim to explore the trajectory of drug use and collect clinical data and biological sample and try to find objective and biomarker for early detection and diagnosis and relapse prevention. The final goal is to develop new intervention strategy for drug use. This is the cohort study. Now we collaborate with several units, including Xiangya Second Hospital and Ningbo, Wuhan, and the Yunnan Institute of Drug Dependence, and collected big data to do some analysis. As I mentioned before, for ATS use, there was no medical treatment. So our group tried to develop non-medical treatment or intervention to treat them. This non-medical treatment including CCAT, rTMS, and VR-based intervention. I think everybody knows rTMS treatment. rTMS has been widely used to treat depression in a clinic, but for addiction treatment, there was not too much study to explore. So in our group, we do a series of study to explore the effect of rTMS on drug abuse prevention. We did lots of study and focus on this topic and find rTMS could reduce craving and improve cognitive of ATS use. And based on the brain imaging data, we find the functional connective between DRPFC and IPL increased and correlate with craving reduction in the rTMS group. We guess maybe this is the mechanism of rTMS intervention. We also published a lot of articles to focus on this topic. Another one is CCATs also target ATS use. We know that compared to the traditional drug, meth, the effect of meth could destroy the cognitive of the patients. So CCAT focus on attention control training. They also focus on working memory training task. Patients use CCAT to practice, and we also conduct assessment. The doctor could collect the data and modify the training program based on the data analysis results. Also, we will send the results to the patient and let them know the change of their behavior after practice. This is the CCAT training. We also show some drug-related cue to investigate their craving. This is the data to show that the CCAT could improve risk decision-making among the ATS users. Other intervention strategy is VR-based intervention. The characteristic of VR technology is to create a virtual environment for user. The user can have the feeling of immersion in the virtual environment. Based on the VR technology, we use biofeedback therapy combined with cue exposure therapy to decrease craving and cue-related reactivities in meth use. And the VR-based intervention strategy has been widely used in China in the compulsory treatment. Other intervention strategies also focus on the emotion regulation and motivational increase and cognitive dysfunction, including like music therapy and mindfulness-based relapse prevention. And now we try to use AI technology to deliver psychological counseling to the drug users. We also provide a training program to the social worker and professional staff among the field of the drug abuse prevention. Every year, we will hold the continual training program. As we all know, for young kids and a high-risk population, so for we develop online 32 episode course, and we also make a macro video to provide education for young adults based on the case report in our clinic. We go to the community to deliver education program to tell the students or the public how to tell the drug and how to say no to drug abuse. In summary, this is the comprehensive intervention model. We call this model WARMR model. WARMR means W. W means the whole course. A means accurately, R means repeat, and M means measurement based. So actually from the research to clinical and from early intervention to follow-up assessment. So for each patient, we will conduct a whole assessment. So it's a very comprehensive treatment model. In China, especially heroin and meth, we also find other drugs use become more and more common, like laughing gas. As we all know, laughing gas used for food making and also for the medical treatment. But in China, we find some new students, especially from overseas students, they use laughing gas as recreational use. This is the patient, a 19 years old young man, studied in the US and used laughing gas more than 1 year and was wheeled into the clinic by his parents. His complaint was paranoia and hallucination. This video cannot play. I don't know why, but if you can watch the video on the web, maybe you can find the patients had hyptonia, especially distal. And we provide treatment. It also cannot play the video. This treatment, after two weeks treatment, the patient's emotion was stable and there was no psychotic symptom. And after about 2 months treatment, the patients can stand up. Other ATS, because we know ATS could decrease appetite, so some young girls use them to lose weight and induce psychotic symptom. This picture, this is my case. The young lady, she used the ATS to lose weight. He used different kind of medicine to lose weight, means cocktail diet. Other reason, other one for the ATS use is in the students. We know low dose ATS could improve attention, so some students use them before the exam to improve their study abilities. Based on our study, we find more and more students use the ATS to improve their study abilities. In conclusion, in China, the public has realized the harm of meth and reduced the use of drugs, but some new psychoactive substance with stronger toxicity and gradually increasing and threatening more people. So I think maybe in the future, we should, in our country, we should pay more attention to these issues. Okay, that's all. Thank you.